Hello, everyone, and welcome to episode 36 of Divergent Dialogues. Today, we're going to be talking about inaccessibility to mental health care and assessment for autistic folks and ADHDers. So, this is a topic of intense interest for me, namely because this is a big part of my PhD research where I'm looking into best practice for mental health care for autistic folks. So part of that is having a look at all the, particularly in my introduction and literature review, looking into all of the challenges, which can be a little bit difficult because there is a lot of them. But I do want to say what's really impressive is that there is a lot of research coming out, particularly in the last few years in this area. And there's a lot of people that are often a lot of neurodivergent folks themselves, researchers or practitioners that are wanting to make change in this space. So I think that's really positive. We're probably like at the beginning-ish stages of things, but I think it's positive that we are, heading in that direction. Um, so I thought what might help is to maybe focus on the assessment side of things and then maybe go more into like the practice side of things. And I guess because the barriers to both can be similar, but there can be differences. So yeah, I guess Teena, what are some of the barriers that you've identified for autistic folks and ADHDs seeking assessment?
Yeah, as you said, Caitlin, there are many, and I think that the first barrier is, in my opinion, is just trying to figure out the process and who's who in the zoo. What do I need to do? Where do I need to go? Because that can be quite confusing. And eh, part of that barrier is around like what's the purpose of the assessment. Are you looking for diagnostic clarification? Are you looking for formal diagnosis? What are you looking to have the assessment done for? Because that will inform where you go and who you go to see, because it is really, really confusing.
Yeah, I think sometimes people come to me for support and they are kind of actually wanting clarification on the process on how they can go about getting an assessment. So a lot of times I get asked, oh, are you willing to work with me? I don't have a formal diagnosis. And, as someone who's neuro-affirming, I'm happy to work with people who may not have a formal diagnosis because, it's really expensive and not everyone can afford it. And, at the end of the day, if people are having these challenges that are popping up in their life, my stance is that I'm here to support them regardless of whether, if they're having a sensory issue, they're having a sensory issue, like regardless of whether they have a autism diagnosis or not. So like I'm happy to work on addressing some of those challenges for people. But yeah, often there can be a lot of anxiety around either not understanding the process or being really anxious that they'll be dismissed and all these kinds of things. So and there isn't like a ton of information out there regarding what to do really.
Yeah, because there's the like the cost, as you mentioned, it is quite expensive. And some people can access rebates like through Medicare Better Access with a referral from their GP, but that's only if you are under the age of 25. And like people don't know that. Some people think that they have to start at their GP and the GP has to refer them somewhere. But yeah, that's not necessarily the case either. You can self-refer for an assessment. You can't access any rebates if you self-refer. But then who do you go to? Because if you are wanting a diagnosis so you can access NDIS or disability support pension, then those organizations only going to accept a diagnosis of autism from either a clinical psychologist or a psychiatrist, or a pediatrician if you have a child. Yeah. And for ADHD, well, yeah, NDIS and DSP, they're probably going to accept that anyway. But if you want to access medication as a part of your treatment for ADHD and treatment and support, then it has to be a psychiatrist. Some psychiatrists will accept diagnostic assessments and reports that have been completed by general psychologists, accredited mental health social workers, but some psychiatrists will not. They will tell you, nope, you're going to have to do the assessment again with me and pay for it again. So it is pretty confusing when you're trying to navigate it and understand, who's who, what's what do I need, why do I need it, and how do I get it?
Yeah, and I mean, even if you're not seeking assessment, if you're seeking mental health support, like you can just contact like an accredited mental health social worker or a clinical psychologist or OT or whatever directly, but like you would have to pay privately. If you are wanting to access the Medicare rebates, well, that's when you have to go to your GP and get those referrals. So some people, they don't even know that. Like, obviously a lot of people prefer to get the rebate, but sometimes that can be a barrier. Just it's like the step before the step. It's like it's already daunting enough to contact a therapist. So what I've got to do is sidestep, go to the GP, get this, go to the therapist. So I find that sometimes people might come and see me for a few sessions, and then once they decided that they want to continue to see me, then they'll go to their GP and they'll get get the mental health care plan and come and see me, because at the end of the day there's 10 up to 10 rebated sessions a year. And some people may see me more than that anyway. So there may be a time when they have to pay the full fee anyway. Um, and yeah, it's very rare that people bulk bill these days, because the bulk bill rate is very low. And unfortunately, I'd love it if I was in a position where I could do that. But yeah, unfortunately, as a neurodivergent person who works part-time, and it's unfortunately not sustainable for businesses to be able to do that. Even GPs, I remember the good old days when we used to be able to go to GP bulk build, and that's very rare these days as well. So yeah, I guess it all adds up, doesn't it?
Yeah, it certainly does. And some clients, they avoid that GP step to get the care plan or a referral, because there's a fear of being dismissed and not taken seriously. So some people will come and see me privately, uh, kind of to check first, are my challenges or my struggles enough to warrant the care plan? And the answer is usually yes.
Yeah. Yeah, often I think people book an appointment with me because they're seeking some reassurance and validation around their suspicions that they're neurodivergent, because they are scared to approach a doctor, whether it's their GP or to go to a psychiatrist. And obviously, like, it's a really big cost. So even if you just go to one appointment with a psychiatrist and then they say no, then yeah, it's a lot more out of pocket as well. So but even so, like, there's been some people that I've worked with where it's taken like a year for them to be in a position where they feel confident enough to be able to go through that process, or to broach that with their GP that they may have been seeing for a really long time, for fear of dismissal. So I think that's why it's really important that uh, there is training around being able to identify like autism and ADHD, and that's something that came up a lot in the literature with my literature review. And not and like for me, it's mainly focused on mental health professionals, but I just think like GPs at the end of the day, they are the ones who will be providing these sorts of referrals. Like they're gonna see a lot more patients just in general. Like they're gonna see a lot more people. So I think it's really important that they're able to have like a foundational understanding of what that looks like, particularly for folks that might be higher masking or they might not have that kind of, typical presentation that is put forward, because it can cause a lot of distress and it can delay people getting access to the support that they desperately need. So there's some people that I have worked with, that are late diagnosed that, because unfortunately the people that they sought help for, perhaps didn't have that awareness and training, their mental health has really suffered and like their self-esteem and confidence in engaging with healthcare systems has, been really negatively impacted.
Yeah, I in my PhD literature review, I reviewed some a study done by Murphy et al. And in that she did it was a qualitative study on women accessing assessment for autism. And she spoke about uh, participants who shared that they had gone to the GP, like wanting a referral, and they were dismissed with comments like, uh, you're too old to be autistic. Um, you're too successful to have ADHD. Why are you doing this now? What does it matter? You've got this far in life. And those kinds of comments, they are crippling, and they can absolutely prevent someone from, yeah, further pursuing their assessment. And that diagnosis can be so validating, which is what the research also found, that once received a diagnosis, people report feeling really validated, understanding like their whole life and the struggles, and everything just falls into place and makes sense. It is life changing.
Yeah. And I think like there's such a professional responsibility to ensure that we have adequate training when making these sorts of determinations. Like I've just heard similar stories where clients have gone to a GP and they've just been like, no, you don't, you're not autistic. And I mean, at the end of the day, it's up to the specialist to determine that. Like, obviously as a GP, they need to determine whether there's enough evidence to warrant a referral. Like obviously if they just gave referrals willy-nilly to everyone, I can understand that. But, if it might be worth encouraging them to see another GP who perhaps has a little bit more knowledge or understanding in that area if you're not sure. Like I guess as a professional, like I'm always okay to put my hand up and be like, hey, this particular thing that you're needing help with, that's out of my scope. So, you might need to go see someone else or, maybe I'll upskill or whatever, but it's not my area of expertise. But I just think it's like I really wanna stress how important it is that people aren't being dismissed because it can be life-threatening or life-changing, and life-supporting for some people, and at the end of the day, as a professional person, as a doctor, like there is a power imbalance there. And, they're going to see a doctor and they're going, okay, well, this is a highly qualified professional who's told me no. So I'm going to trust that. Uh,
Yeah.
and unfortunately it's led to a lot of distress and years and years of not being adequately supported.
Mhm. And I just want to say on that Ryan's rule is a thing for a very good reason. And those who don't know what Ryan's rule is, it's a like a rule in hospital in Queensland, that it's essentially because parents weren't being listened to when they were telling doctors there's something wrong with my child. There's more going on here, and it did result in the death of a child. And yeah, laws changed where Ryan's rule. You can say, no, I want a second opinion, because doctors are human, and they can only hold so much knowledge. And if that knowledge isn't in the space of autism and ADHD, then they might make mistakes.
Yeah. Yeah, definitely.
Mm.
And I guess like someone might argue, oh, well, this isn't costing lives. And I would argue it definitely is,
Hmm.
because there is a much higher prevalence of mental health issues in the like autistic and ADHD community. Like often there's depression, there's anxiety, and if someone isn't getting the medical treatment, medications if needed, or the access to the support, it can take a massive impact on mental health and self-esteem. And, if people are better supported, like there's less likelihood of that happening. And not just that, but it's about quality of life. Not being able to engage in day-to-day activities or things that people want to do, or work towards things that they would otherwise be able to if they had that support that they needed. So yeah, I think that's a point I just really, really want to stress. And I also, like, if anyone's listening and they've been in that position where they strongly feel that they are autistic and or ADHD and they have been dismissed, try again. Try someone else. Maybe look for someone who, even a GP or someone who has a bit more of an understanding and specialization in that area. And yeah, and give it a go. Because like I would say that, like, everyone who's come to see me that hasn't had a formal diagnosis and said, "Oh, I'm pretty sure," like 100% of the time, they've gone and they've got an assessment and they have been. So, like, I know that there's that whole joke of, "Oh, everyone's ADHD and everyone's autistic and everyone's learnt it from TikTok." I mean, a lot of this information is a lot more available, so people watch these videos and go, "Oh my gosh, like, that is me." But I highly doubt that someone would just watch one TikTok video and then turn up to the GP and go, "Oh, I'm autistic." Like, people, like, they sit on this stuff for months, sometimes years before they actually actively do something because they're so worried that they're going to be shut down.
Yeah, yeah, you're absolutely right. And yeah, I when you're looking for a GP, it can also be helpful to ask for recommendations. There's lots of support group um, type groups on Facebook and whatnot, and joining one of those and asking people for recommendations of GPs that have a good understanding of autism and ADHD can be a good place to start, because yeah, it's people GPs will list their areas of interest. So, on the website or whatever, and you might see that they have listed autism or ADHD, thinking, okay, they might know, but yeah, just because it's something that is listed, you can't really know exactly how thorough their understanding is, or what their um attitude is to um supporting people to explore that.
Yeah, so, like, they may say that they have an interest in autism or ADHD, but that may not be from a neuro-affirming lens. So that's something to consider as well. But yeah, there are, like, I mean, like, in Australia, there's a bunch of them. I don't know elsewhere, but yeah, going to one of those can be a good place to start. Um,
It extends on to actually finding someone to do your assessment as well. Again, lots of people will list that they conduct an autism ADHD assessment, but is that being conducted through a neuro-affirming lens, and what is their understanding of that particular assessment and diagnosis? For accredited mental health social workers, for us to be qualified to do an autism and ADHD assessment, we have to do very specific training in those assessment tools. So we have a a level of understanding of the assessment tools and the diagnostic criteria, for those particular diagnoses, where other clinicians, they are qualified just to conduct assessments, full stop. So they're making sure that their knowledge on the particular diagnoses that you are requesting assessment for is important.
Something else to consider as well, sometimes clinicians may not offer ongoing support. So sometimes I've had clients who they've gone to someone for an assessment and then they've wanted to continue to see them for therapeutic support, but that's not what they provide. So there may be some people who just do assessments, who just do therapy, who do a bit of both. So if you're intending to see someone who you can see long term, just like make sure that you check in and see that that's something that they do, because yeah, sometimes people don't, and then they're like, oh great, now I've got to go find someone else again. So
Very, very good point. Very good point.
yeah. So I thought we might move more into talking about some of the challenges that can come up when trying to access mental health support, in particular, trying to find a suitable therapist, and some things that can just kind of pop up when it comes to like accessing the space, or what's going on in that environment. So as I said before, even among mental health professionals, there can be like a lack of autism-specific training, and even then, it's probably even less if it's neuro-affirming autism-specific training. So, when you are looking for someone, just make sure that it is from a neuro-affirming lens, because they might be like, "Oh, I've got like X amount of years working with autistic folks," but, is that from the pathology paradigm, or is that from that neuro-affirming um paradigm? And it's really important that they have an understanding from lived experience. So it doesn't necessarily mean that they have their own lived experience, but that they have they might use resources or have an understanding of like the autistic and the ADHD community. I think something else to consider as well is that I find that a lot of folks do come to see me because I am open about my lived experience. And I do think that fundamentally, when you do have lived experience, it can be really helpful for people, because I guess they feel like there's this inherent shared understanding. But on the flip side, don't just assume because someone has lived experience that they are actually neuro affirming. Like I was trained clinically. I didn't even know I was autistic and ADHD. And then, I worked clinically for a long time. And then I went out into the wide world and was like, oh, there's other ways to, support and work with people. Like as a social worker, I still felt like I had a lot of, great frameworks and modalities that I used to connect with people. But, because I had worked in that medical system, you adopt these things, and you a big part of why I did leave working in those systems is because I was just like, this doesn't feel right for me, this doesn't fit with my values, like what the heck's going on here? And so yeah, so it's a lot of work, even as someone who does have lived experience. Like when you are late diagnosed, like you've got to do a lot of your own inner work and unlearning as well. So yeah, I think, like, I'm not saying that if you don't have lived experience that you can't support autistic ADHDs. That's definitely not what I'm saying. But I think it can be an asset, but also like it doesn't necessarily mean that that person's going to be a good fit for you if they have lived experience.
Yeah, I completely agree. In my clinical journey, having worked with lots of different people, like colleagues, as in working alongside, I have watched how the lived experience can sometimes yeah, can sometimes get in the way because we make assumptions about what that means when a person has lived experience. But yeah, it doesn't necessarily mean that it's going to be neuro-affirming or a good fit. But it is also, yeah, I agree. I think it's helpful. I think that people uh it's always interesting that when someone's in my office with me and I share bits about my own lived experience, um it's seeing a person like a sense of relief, because I often hear over and over and over again people saying things like oh, I just don't know how to explain it. Oh, uh, it's this is what happens, but I just, oh, I just don't know how to explain it. And when I can sort of paraphrase the thing that they can't even say, and like, oh, I think I kind of know what you're talking about. Is it a bit like this? And they're like, yes. It's a piece of relief where it's like, right, this person gets it. And I didn't even have to find the words.
Yeah, yeah. And I think, like, it is important for us to reflect and make sure that we, aren't, I guess, projecting our journey onto others. But I think, like what you said there, Tina, just kind of offering and going, "Hey, like, I think this might be what's going on. Is that, like, does that fit for you?" And it's like, "Yes." And yeah, I've had that before where they're like, "Oh, like, I feel like you're just, like, narrating my inner experience." And I'm just like, "Yeah, well, this has, like, been my life." So, yeah, I do. But yeah, like, everyone has their own journey, but yeah, I think, like, something that can be a challenge and pop up for some people, uh, when accessing support, like therapeutic support, is that, like, difference in communication. And, if someone is a therapist who isn't, autistic or ADHD, they may relate and communicate in a way that might be a little bit confusing or different or whatever. And we've got that double empathy problem as well. Like, it just, I guess, it can add a layer of misunderstanding at a baseline. Um, so I think, like, if you're not someone who uses their lived experience in their practice, it's super important that you do really work to get a really good understanding through, other people's lived experience, whether that's through training or online or TikTok or, whatever else it is.
I completely agree. I think it is really helpful because it's not always easy to put into words, and I think that it is that lived experience or that understanding of lived experience that can often give you the ability to find the words that are otherwise just, yeah, unobtainable.
Yeah, yeah. So some of the things that popped up in the research, can be a lot of, like, environmental barriers. So sometimes, the building or the room, may not be particularly sensory friendly or accessible. So I guess that's something else to consider when you're working with autistic ADHDers. Or, unfortunately, I live, up not where I live. I work in, like, quite a busy suburb, which is a bit chaotic. So it's like it's good in the sense is it's accessible. There's, like, parking, there's, like, a train, there's, like, a bus, like, awesome in that regard. But I guess because of that, it makes it, quite a busy spot. So, it's not just your actual room. Sometimes it's, like, the journey for someone to get there. And, like, for example, for some people, when they get to my office, they, get a little bit frazzled, and they're not sure because there's, like, a bunch of offices there. So, one day I was like, "Oh, what I'll do is I'll, like, record a video and put it in," like, I put it on, like, Google, I think, and I put it on my welcome email so that people can watch it, and they just, like, watch it. And, like, since I did that, I haven't had anyone kinda call me and be like, "I don't know where I am, can you help me?" And, like, there's a few times where I has, like, walk out and be like, "Hi." Like, I'm here. So, I think even with best intentions, um, we have to kind of reflect and refine these sorts of things. Like, I didn't think to do that. And then I was like, "Oh, well, that would just make it'll be less distress for me because I'm not having to holler out on the street, and also the person's not gonna be in distress, because they're late or they're not sure where they're going. Um, so yeah, like unfortunately, I mean, as much as I'd love to, we can't control all the variables, but if there's some sticking points or you're getting feedback from clients and things like that, it might be worth revising that and go, oh, okay, well, can I just swap out the light bulbs to something that's a little bit dimmer? Or, maybe I won't put on those essential oils anymore because for some people that's a bit overpowering or whatever it is.
Mm. Yeah, I have a dimmer light in my office, so it's yeah, up, down, up, down.
You just like sit there all day, like trying to get at the exact brightness.
Yeah, because it's like it's really helpful for me as well because some days I need the bright light because I need that extra to stimulate, and other days I need it dimmer because it's just like, whoa, the world is too much. So it's helpful. It's helpful for me too.
That's so interesting. For me, it's like it always has to be the same. Like, obviously very autistic. It has to be exactly the same. The light, everything. So this isn't my office because I wouldn't even know how to start with that wiring. But in my house, I have sorry, going a bit off track here. In my house, I have like smart lights, and I've literally like got specific lights and specific brightness and like it's this setup so it's like exactly the right brightness of a nighttime when we have the TV on. Like I don't even have lights on in other areas. So
Yeah,
yes, very
I like it.
MacGyvered it or whatever it's called.
Yeah.
So yeah. So like again, like you can just see between Tia and I, we have those differences. So I think having things that can be customized quite easily, then that helps because having options. I think things can become a problem when there aren't options, and we might not always be able to offer exactly what people are needing or wanting, but at least like trying to meet someone where they're at or being kind of accepting of that. Like, even, like, if you can't dim the lights, just be like, if you wanna wear your sunnies in here, like, that's totally fine, like, you can do that. Like, I'm not gonna yeah, so these sorts of things, thinking outside the box a little bit if we can't necessarily change the environment because, like, we might not own the building or it might not we might be our boss that owns it or whatever, so
Yeah. But yeah, there are sometimes ways that you can get around these things. Um to make it all a little bit easier.
yeah. So I think, yeah, we've talked about like some of those financial barriers around accessing support. And I think with assessment often there is a big upfront cost. So I think for some people, accessing therapy as opposed to getting a formal diagnosis, depending on, I guess, where they're at, I think sometimes they're like, well, I'd rather spend money on getting the help that I need, than spending it on an assessment. And I always say to my clients that, getting a formal assessment, it is a choice. Like it can unfortunately have some ramifications if you have some of these like formal diagnoses. Um, and for some people, they just even just having a discussion and exploring that is enough for them as opposed to getting a formal diagnosis. But obviously it can open up areas for support. So unfortunately, ADHD isn't recognized by NDIS. But you can get funding for support. Sorry, you can get funding for support, like therapeutic support as a autistic person, like obviously depending on your needs, but you need that documentation and you need to get approved and all that kind of thing. So I guess that's something to consider. And yeah, like in Australia there is Medicare as well where you can get some it's rebated sessions and things like that. So yeah, it can be a little bit of a challenge, but um, you know, I think sometimes people feel like there's an expectation of how much they have to go to therapy and like ideally, especially when you're first starting out, it is good to go like a little bit more frequently. But at the end of the day, like people have to access that at, what they can afford. So, sometimes I might see people monthly or, every 6 weeks or something like that. And just being really purposeful with those sessions and things like that. So, um, yeah, I guess, kind of access it in the way that you can.
Yeah. And it can be helpful if if your finances are limited, to know when you're going into, you know, therapy, to know exactly what it is that you're wanting help and support with, and how you best receive that support. Because there's different ways. There's different ways to, for people to be supported. And sometimes it's about unpacking and understanding. Other times it is more sort of that practical, skill-based acquisition type thing. So yeah, having some idea of what feels better for you and knowing what you want help with, that can definitely make things more cost effective.
Yes. Yeah, so we're gonna have a future episode that's gonna talk more about therapy processes, so we'll kind of go into that a little bit more. But yeah, I think like some things that can be helpful, as Tina said, is like, preparing for therapy sessions. Like if you do, you see monthly or whatever, having a bit of an idea of what you're wanting to talk about. So something I'll say to my clients is, have a little note in your phone or a diary. And whenever you think of something, go, oh, I'd really like to talk to Caitlin about that. Or, oh, that's really important. I want to address that. Just jot it down. And then, you'll get to, because sometimes I have clients and they're like, oh, like I had so many things I want to talk about, but I forgot. So, and especially when it's such a long time between appointments.
Yeah.
So just jotting it down, and like I'll have some clients and we'll just kind of go through item by item and kind of address those things like in that kind of manner, and I'm completely comfortable and okay with that. I don't know if you do anything similar, Tina.
Oh yeah, yeah, definitely. I love it when people come along and they whip their phone out and like, well, I've just got a few things that I've noted down. But
Yeah, so here's my therapy agenda for today. Something else that it can be a little bit tricky but can be helpful, and hopefully you're working with a therapist that you feel like is comfortable to bring these things up with. But if there is something in the environment that is overwhelming or distressing for you, and like obviously like sometimes the therapist might not be able to change that, but you might be able to problem solve together around what can be done to help make you feel a little bit more calm in that space. So sometimes it's about taking things away, sometimes about adding things. So it might be like, oh, do we want a weighted blanket, or do we want some fidgets, or maybe try using some noise cancelling earphones to cut out whatever. And there might be like a light that's making that annoying buzzing noise, and can't do it in the dark. So
I've
yeah,
come
so
in, my air conditioner in my office starts dripping, and it's like it's just got this sound from the cartoon, like the kids' cartoon, the Octonauts. It just yeah,
yeah,
really annoying.
yeah. But like I can tell you, like I would say, well, I would hope that therapists would want you to be comfortable in that space, because that's going to be, if you're comfortable, you're going to be able to, engage in that process a lot better. So, if you're feeling a little bit nervous, that's totally okay. And I think for a lot of us, particularly late diagnosed folks, we're not used to asking for our neurodivergent needs to be met. But just bring it up and go, hey, this light is a little bit bright. Are there other options for lighting or whatever? And again, like as I said, like the therapist might not have thought of that and been like, oh yeah, oh my goodness, like yeah, maybe I should just get like a dimmable light. That would be way better, and it could benefit a lot of their other clients as well. So, but yeah, so sometimes it can be hard to be a little bit brave, but just bring it up and see what they say. If they do have a negative reaction, then that's kind of information as well, that maybe they're not the best fit and they're maybe not super affirming. So, yeah, that's something to consider.
Point.
It's like, no, I will not. Yeah. But like generally, like, as I said, there's some things that can't be changed, but at least a willingness or oh, look, sorry, if I could, then I would.
Mm. Yeah, absolutely.
But yeah, like I love sunnies. I'll wear sunnies inside. Like when I go to the shop sometimes, I'll do that. People are funny, but I'm like, I don't care. I don't want sensory.
Sometimes I don't have a choice because my sunglasses like your prescription, and if I've left my glasses somewhere because I've had my prescription sunglasses on, I can't take them off when I go in the shop because I'm like walking around all squinty, can't see. It's just yeah. So yeah.
It was funny. A little while ago I got contact lenses, and then I went to put my sunglasses on, which are prescription sunglasses, and then I was like, no, my contacts and my sunglasses with a prescription. And yeah, anyway, because I got rid of all of my normal sunglasses. I'm like, oh, I'm not going to need these anymore. Yeah, well, joke's on me.
Yeah.
But anyway,
Yeah. Wow.
that's why I'll have to go get some. But I can't drive without sunglasses because it's just like we live in Brisbane, which the sun is just like beaming down.
Where?
Yes. But anyway, I think that kind of sums it up, and that's kind of everything we wanted to cover today, Tina, unless there was anything you wanted to add or you think we've missed or
No, I think we've touched on all the things.
yeah, so I think like it all of these challenges, they can feel really big and really overwhelming. And like even as a professional person, like sometimes I look at all these things and with my PhD, I'm like, oh my gosh, like where do we even start? But I think that there are a lot of professionals that are really committed to making change. And at the end of the day, that's what's gonna, actually make the change. All of us individually taking this on board and taking it seriously and doing our part in order to, contribute to being more neuro-affirming and understanding and learning as well. So, I can feel the walls closing in sometimes, but yeah, it's great when I get to, look on social media and see all the great things that people are doing or read all the research that's coming out and being like, wow, this is amazing. So, like from all over the world as well, working towards, yeah, a better future. So that is promising, I feel.
Yes, I think so too.
Okay. Awesome. Well, thank you everyone for joining us today, and catch you next time.
Thank you.